Shoulder pain can be debilitating, and here to talk about it is Brett Price and his surgeon, Dr. Gary Updegrove, orthopedic surgeon with Penn State Bone and Joint Institute. Thanks for both for being with us today.
Thank you.
Brett, why don't you talk to us about what your situation was and what you decided to do?
So it started for me back when I was 22 years old. I had an accident that resulted in a dislocation of my left shoulder. I didn't do much with it medically at that time, but over the next 40 years, I had limited use of my left arm, experiencing difficulty in certain movements like overhead, out to the side, and behind the back. Eventually, arthritis set in. My daughter, Lauren, is a PA with the Bone and Joint Institute at Hershey Medical. We had a conversation one day when she was home, and she suggested that I go up to Hershey and meet with Dr. Updegrove and have him take a look at my shoulder, which I did.
So Dr. Updegrove, what was your plan? What did you suggest?
So Brett presented with shoulder arthritis, likely related to his dislocation episode in his youth. And when we first meet a patient with shoulder arthritis, we talk about non-operative management like activity modification, use of anti-inflammatory medications, some home exercises, and in some case corticosteroid injections. And then we also talk about shoulder replacement options, including a regular shoulder replacement or what's a reverse total shoulder replacement.
So Brett, you had lots of options. What were you thinking? What did you decide to do?
So I'd never been through any significant surgery before, and I wasn't in any hurry to go through it. So I decided to wait and see how long I could actually live with the condition. But that lasted just about a year. The arthritis became increasingly worse to the point where the pain became constant and it started majorly interfering with my sleep. So I called my daughter one day and I said I had enough and I'm ready to move forward with the operation. So she got things started for me. I had a few appointments set up, which led to the meeting, the pre-surgery meeting with Dr. Updegrove, where he went through the entire surgical process with me, the hardware that I would be receiving, and the methods that he uses in practicing for the surgery, which I found to be extremely interesting because I never heard of any technology like that. And it actually helped boost my confidence level for the surgery.
Okay, so you got the green light to go ahead and do this. So why don't you talk to us about this new technology? I see you brought some things in. We're going to get some close-ups of it.
Sure. So what we're doing now is what's called mixed reality shoulder arthroplasty. And what I do is I take a patient's anatomy obtained by the CT scan and we upload it into a computer, and I can go into the computer and basically perform the surgery in a virtual environment. That's sizing implants and placing them in an appropriate position, correcting deformity. And then what we'll do is we'll take that plan and we can upload it into the goggles, and in the surgery in real time we can actually, or I can see the patient's anatomy, see their plan as a 3D hologram that I keep next to them while I'm operating. So I actually see while I'm working on him exactly what I want to do, how I want to reconstruct his anatomy, and how I want to perform the replacement. Additionally, we actually take the information, and in Brett's case here, we can print a model of his actual anatomy and a guide that we designed in the computer to make sure we can put that into him and get our placement exactly where we want it.
And so that's what those small pieces are?
Correct, yes.
That's the actual replacement.
Well, this is the replacement. These are actually guides that we use. This is actually Brett's socket. That's the printout of his glenoid, and this is his guide that we had in the surgery to help align where we want to do, mixed in with our mixed reality.
Wow, that is really amazing. I can see why you have the confidence. Talk to me about how was recovery?
Well, actually, recovery wasn't as bad as I initially anticipated. The worst part for me was the 6 weeks I had to spend in a sling because you kind of have to sleep in the sling, sitting up, and that didn't work out very well for me. The pain was generally mild. I was able to get through that with basically just Tylenol and Aleve from day one.
That's amazing.
And physical therapy was a little slow at first because I was very tight in the shoulder, which I'm told is normal because your shoulder's in a locked position for those 6 weeks. But by working with the exercises and stretches that I was taught by the physical therapist frequently, I was able to loosen things up pretty quickly.
So it's been 4 months. You look like you're doing all right. How do you feel?
I feel great. I'm really happy with where I'm at. I have about 80% of my mobility back. It's a great feeling to be able to move my arm and shoulder into different positions without having any discomfort or pain. And I'm really looking forward to the next several months because I believe my mobility will continue to improve, and I'm going to be able to get that quality of life back that I haven't experienced for over 40 years.
And we were talking earlier, you said there are some things that you haven't been able to do for years.
Yeah, right. So golf, for example, I love the golf, and my golf swing has always been limited, and it's just, I've never been able to take a full swing without that discomfort and pain, so I'm really excited to get to the point where I can, you know, take a full swing and in a comfortable situation.
Dr. Updegrove, he's thanking you for his golf game. This stuff is really amazing, the technology. Where do you see this moving as far as the future?
So this is rapidly progressive. I was one of the first surgeons in the country to be able to incorporate mixed reality into my clinical practice.
Congratulations.
Thank you. I've been now working with the company as we help improve this technology, and we'll be one of the first in the country to get the next phase. So now we'll be able to actually take the patient's anatomy in the operating room and link it into our headset, so I can actually interlace their CT scan and my plan actually into the patient themselves and to improve the accuracy of how we do it. Wow. Additionally, we now have the ability to do 3D custom implants. So for really complex deformities, rather than trying to get the patient's anatomy to match to one of our current implants in the portfolio, we can design it ahead of time. I'll design it on the computer, and then I can have it printed and shipped as a custom implant for that patient.
Wow, amazing. So glad you both were here. And Brett, thank you so much for sharing your story.
Thank you for having me.
Thank you so much.
And if you would like more information, or if you would like to make an appointment with Penn State Bone and Joint Institute, this is the number you can call, 717-531-5638, or visit online at pennstatehealth.org.